Hello. Today we'll be discussing care and treatment of HIV and AIDS. HIV, the virus that causes AIDS, is one of the world's most serious public health challenges. But there is a global commitment to stopping new HIV infections, ensuring that everyone with HIV has access to treatment. There are many types of treatment and care for people living with HIV and AIDS global around the world as well. My name is Latoya, and I appreciate you taking the time to discuss this very important topic with me today. HIV and AIDS. What is HIV? HIV, human immunodeficiency virus, is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. What is AIDS? AIDS is the last stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. How does HIV and AIDS spread? It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex without a condom, or HIV vaccine to prevent or treat HIV, or through sharing injection drug equipment. HIV is spread only in extremely rare cases by having oral sex, receiving blood transfusions, blood products, or organ tissue transplants that are contaminated with HIV. Being bitten by a person with HIV, deep open mouth kissing if both partners have sores or bleeding gums, and blood from HIV positive partner gets into the bloodstream of the HIV negative partner. Eating food that has been pre-chewed by another person with HIV. The symptoms of HIV and AIDS. There are several symptoms. Not everyone will have the same symptoms. However, it depends on the person and what stage of the disease they are in. Flu-like symptoms can include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, mouth ulcers. HIV care continuing. HIV care continuing. The term care refers to the sequence of steps a person with HIV takes from diagnosis through receiving treatment until his or her viral load is suppressed to undetectable levels. Each step in the continuum is marked by an assessment of the number of people who have reached that stage. The stages are being diagnosed with HIV, being linked to medical care, starting ART, adhering to treatment regimen, and finally have HIV suppressed to undetectable levels in the blood. According to research and reports, in 2021, of all people with HIV worldwide, 85% knew their HIV status. 75% were accessing ART. 68% were virally suppressed. As of the end of 2021, 28.7 million people were HIV, 75% were ART globally. That means 9.7 million people are still waiting. HIV treatment access is key to global efforts to end AIDS as a public health threat. People with HIV who are aware of their status take ART as prescribed and get and keep undetectable viral load can live long and healthy lives and will not transmit HIV to their HIV negative partners through sex. So, some fast facts. We have approximately 1.2 million people in the U.S. have HIV. About 13% of them don't know it and need testing. HIV continues to have a disproportionate impact on several populations, particularly racial and ethnic minorities and gay, bisexual, and other men who have sex with men. In 2019, an estimated 34,800 new HIV infections occurred in the U.S. New HIV infections declined 8% from 37,800 in 2015 to 34,800 in 2019 after a period of general stability. In 2020, 30,365 people received an HIV diagnosis in U.S. and 6 dependent areas, a 17% decrease from the prior year, likely due to the impact of the COVID-19 pandemic on HIV prevention, testing, and care-related services. HIV diagnoses are not distributed across states and regions. The highest rates of new diagnoses continue to occur in the South. Some added facts we will have: number of people with HIV. There were approximately 38.4 million people across the globe with HIV in 2020. Of these, 36.7 million were adults and 1.7 million were children under the age of 15. In addition, 54% were women and girls. Regional impact. The vast majority of people with HIV are in low and middle income countries. In 2021, there were 20.6 million people with HIV, and that's 53%, in Eastern and Southern Africa. 5 million, and that's 13%, in Western and Central Africa. 6 million, that's 15%, in Asia and Pacific. 2.3 million, and that's 5%, in Western and Central Europe and North America. So in conclusion with our research today about the care and treatment of AIDS, we have found that people with HIV who take HIV medicine as prescribed and get and keep an undetectable viral load can live long and healthy lives. Also, they will not transmit HIV to their HIV negative partners through sex. It's a serious health condition that can affect anyone regardless of their age, gender, sexual orientation. Thank you for your time, and I hope this information was informative and thought-provoking, and I appreciate your interest and time with me today. Thank you. Have a blessed day.